Hello to anybody who has clicked on this video. As you can tell by the title, this is a video based over what I was previously diagnosed with, which is GPA or Wegener's disease. I'm here just to talk about it a little bit more and to see if anybody out there actually has been diagnosed with this as of recently or in the past, or even if you know about the actual the disease itself and you could maybe inform me on something I may not know. This is more just a video of me reaching out. If you just got diagnosed with Wegener's or GPA, you can maybe use this video as a slight guide to, maybe help you out a little bit. I'll briefly go over what GPA or Wegener's disease is. I'm just going to refer it to GPA for now on. Now, I know this is a different video from my channel, but I feel like this has been on my chest for a little bit, metaphorically and physically speaking. This has been on my chest for a little bit, and I feel like, just going into detail on, well, not too much detail, but going into a little bit of detail on what this is and kind of what things to look forward to, good, bad, whatever the case may be. It's kind of a newer disease, and it's kind of difficult to get answers a lot of the time. And a lot of the time, the doctors don't know all the answers for you, and how the only way you'll know answers is either figure it out the hard way, or maybe there's someone out there that may have an answer for you, which I would hope maybe to create something in the comment section, or maybe some answers get solved, because I was looking across the internet and found there are people out there who have had it, and it's a rare disease, I get it, but there are people out. 3 in 100,000 people are diagnosed with this, is what I was told, and most of them are the ages 40 and up. So getting it at a younger age is much more difficult to handle because of mainly the immunity suppressant and the amounts of medication you have to take daily, and a lot of screening, a lot of doctors, just a lot of things to deal with, chemotherapy, steroids, blood thinners. If you have to get put on blood thinners, that is, which I had to, or have. I'm still on them. How do you get GPA? As far as all the research that I've done and what I've been told, there is no reason or on how you get it, but there are signs of that you may be getting it, but they're very slight. So slight with a big buildup, such as bloody noses. That was mine, where I started having bloody noses, coughing periodically, and then I was told that it was pollen. It was the seasons changing. It was just a bloody nose because of the weather. Okay. They gave me medicine for that. Treated it like a minor flu, something like that. So there's no reason, there's no way of how to get it or anything like that, or where you got it from, nothing like that. It's not hereditary, so you can't get it from a family member. You can't pass it down to a family member. I know that. There is no cure. Unfortunately, GPA is still kind of a newer disease, and there's no current cure right now. I've tried looking that up several times. The positives is only you don't have to do chemo treatment that often as like a cancer patient. You only have to do it technically 4 times a year, roughly, maybe more depending on how bad it is, but I think the average is about 4 times a year. But the type of medicine that GPA patients are on are quite a bit. Immune suppressant drugs, steroids, prednisone, start off pretty high dose and eventually taper down to a lower dose, so you will gain weight. I gained a lot of weight myself. It sucks. Going through the illness, I recently weighed, when I first started, I weighed about, when I was coughing and my nose was bleeding, I ended up actually coughing up blood and vomiting blood quite a bit until it got to the point where it was really painful, and I ended up going to the hospital, the emergency room, and then took care from there. But around that, I was, I think, about 195 pounds, I think. And then going through the hospital, I lost about 10 pounds, about 180. I think I weighed about 175, 180 pounds. And then after that, I started gaining weight up to about 200. And then the steroids every day, started taking those, and then actually gained a lot of weight. One of the things I found online is to kind of watch the sugars that you put into your body when on with a GPA. Is don't try to consume as much sugar. Caffeine is okay, but don't overabuse it, of course. A lot of things is sugars, like in energy drinks or anything. I still drink them. Protein, potassium, lead. A lot of my stuff was low. My white blood cell count went up to 1.1 million, I think, and it's supposed to be, I don't know, but it's supposed to be pretty low. I marked the 1 million mark, I think, on 3 or 4 different tests. So when you're first diagnosed with GPA, and if you are in the hospital right now, which I actually live in a hospital, a lot of the tests they do might be annoying. They will do blood tests almost every day, if not 2 times or 3 times a day, depending on what they have scheduled for you. But at least from my experience, I had a test every day done for blood. I had, I think, 2 or 3 tests for blood work done every day. One of them at like 3 a.m., which sucks, but nothing like them coming in at 3 a.m. while you're sleeping, taking anywhere from 6 to 16 vials of blood. It can be pretty annoying, but you get used to it. I got a central line put in on my arm right up here. Here I put a central line in so they can actually get blood from my heart, or like from near my heart. The tube comes through here all the way around to right here, I think, around. So then when your heart beats, the blood gets pumped into the tube almost, and it just makes it easier for withdrawing blood. Much easier. So they put that in super late, unfortunately, so that sucked. I wish they would have put it in earlier. It's a little weird how they have to put it in, but for all the people who get queasy, I'm just not gonna talk about it. If you have a fear of needles, good luck. If you have GPA, because you're gonna be dealing with a lot of needles. On top of that, a lot of blood draws, a lot of different medications they gotta put inside of you, and then if you're put on Lovenox, which is a blood thinner, you have to inject a needle into your belly every day, twice a day. I've been doing that for 5 months myself, to myself. It's not terrible, but after doing it for a while, you end up getting bruises here and there, and it becomes extremely hard and to touch almost, because it's very painful, and your skin becomes like harder, almost like a rock. It's like little rocks are inside your belly, but really that's just the medicine. Don't worry about it. It had me worried a little bit. I was like, what the hell is this? So don't worry about it. Most likely you'll have blood in your urine and in your poop. What GPA actually is, it's kind of hard to explain. It's an autoimmune disorder, and it is affected on your lungs, I believe your eyesight, and your kidneys. So you could, I had it affected in my lungs and kidneys, not my eyesight, so I got lucky. I can see, I got great vision, I got tested, everything's good. Lungs, there's a lot of internal bleeding, inflammations within the lungs, quite a bit. I had one that was pretty big in the center, and then a couple on the side. So I was resisting a lot of breathing. Kind of hurts, and I have a lot of that. Unfortunately, I got blood clots on top of that. So, in the tubing of my lungs, so it kind of restricted a lot of breathing. Doing a lot better now. I'm able to maintain it. I'm able to actually talk and not get winded, which is great. I had a point where it was hard to talk, and it hurt to talk even. Coughing hurts, sneezing hurt, yawning can hurt, and the hiccups hiccups are bad. I don't like hiccups. They're not fun. Getting winded very easily, it's going to happen. But it will definitely heal up over time through chemotherapy. And if you get blood clots, they have blood thinners that help kind of sustain that. But there's not really a full healing part of that. It's kind of scars up. Same with the inflammations in your lungs. Once they are kind of past the damaging phase or whatever, it will leave scars in your lungs that when you take a deep breath, it hurts because it's kind of stretching that scar. It's not saying it's going to bust it, just stretching it, and that's why that you feel pain inside of your lungs or chest, which will happen later on, near the second phase. There are relapses, I believe. There are a few. There's always that fear of, oh shoot, am I gonna get this again and go through all the process? Yes, there is. There's definitely chance of that happening. I think people average anywhere from 2 to 4 relapses in their lifetime, which kind of sucks because having to go through all that again is not fun. I think probably about 3 or 4 months just to kind of get back to regular stuff again. So to actually feel more comfortable with getting back to regular stuff, I'd say it probably took about 3 to 4 months. A month or so being in the hospital, so quite a bit of that was already in the hospital, like in the hospital bed. I'm talking about in the bed when you are admitted. Maybe you get lucky. Maybe yours isn't as bad, or maybe yours is worse. I feel bad. I feel bad for anybody who has this disease or has gone through it. Mental health is a really big thing as well. It might not affect right away when you're first going through the process, but the more you realize how serious of a problem or serious a chronic illness may affect your life, can really affect your mental health. The biggest thing is to keep your head up and kind of maybe do what I'm doing, I guess, is reach out and kind of put yourself. I think the hardest thing is putting yourself out there, or letting other people know what's going on. Sometimes this may not you feel comfortable about telling other people, which I don't. It took me a while to start telling other people, and I didn't tell a lot of people at first, and I didn't feel fully comfortable with it, and it took me some time to kind of start adjusting into that. So this is my way of reaching out to anybody who has GPA. Please let me know in the comments below. If you don't feel comfortable with hitting me up in the comments or writing in the comments or whatever, hit me up on Discord. I'll post my Discord link. If you don't know what Discord is, it's similar to Skype, but it's a little bit more personal and much more more variety, I guess. And it's kind of like what I use to socialize. I don't want to put out my personal links or anything. Just know there's always someone out there that could either help you or even just get answers from. I would feel more than happy to help out anybody with any answers that I could even try to tell you. Or if I don't have the answer, then I would love to know the answer, or even if I have some questions. Sum it up, everything up. Living with GPA or Wegener's disease is quite difficult. Especially during 2020 now, with COVID-19 going around, you have to be even more just careful. If you have GPA right now during COVID, I feel bad, because if you get COVID, that attacks your respiratory system, and a lot of the times with GPA, it's already affecting your respiratory system, so getting COVID on top of that could potentially be tragic. It could be very, very bad for you. I don't know what it would do, because I don't know anybody who has had Wegener's who've gotten COVID. But if you have Wegener's and you get COVID, it could potentially kill you. So just be as safe. If you have GPA right now, especially now, be as safe as you can. Do not let others try to control your life. You control your life. Listen to the doctors. That's the biggest thing I could say is if you want to go out drinking with some friends and one of them has COVID and passes it to you, or one might be a carrier and not have it but be a carrier and you get it because you just wanted to go out and have some fun one time, you could catch it. But I'm not saying you shouldn't have fun. Just be very careful, especially wear your mask and everything like that. Be as careful as you possibly can be, because it could affect your life entirely. So if you have GPA, a lot of the other things is you do every type of thing from your legs being scanned all the way up to your head, getting MRIs and CAT scans, CT scans. I've had, I think, CT scans. I've lost count of how many CT scans I've had. It's been I don't know, probably 13 to 20. I don't know. I don't know. I don't really count them. Why? There's no use of counting them. It's not like it's a record or anything. I don't care. You know, it happens. It happens. That's the way you look at it. And GPA isn't the worst thing that you could get. You know, there's always other people in much worse condition, but GPA is pretty bad, and you should treat it with extra care and just be extra safe. Yeah. Shoot. I think that about ends it right there. Sorry again that this is kind of a weird video on my channel, but I feel like, you know, it's about time I reach out and kind of explain some things. If you want to know more about what you go through regularly as someone with GPA during COVID, or if you have any sort of questions about anything really, any type of question you have, I will most likely either answer it or say maybe I don't feel comfortable with answering it if it's maybe too personal or anything like that. Well, I'll probably figure it out. Feel free to share in the comments below. I like I said, I just want this video to reach out to other people maybe that have GPA or are going through it right now, or have been recently received it. Thank you for watching this video, and happy Halloween. Hopefully this video goes out around Halloween. Who knows? But take it easy, and let me know. I'll put the Discord link in the description if you're interested in contacting me or anything like that. Thank you.